Hello, my name is Erica Rochelle AppBooth, and today I'm going to be presenting on an overview of bipolar 1 disorder. I prefer to recognize any type of mental health related condition to use the term condition instead of disorder. So I do want to know, and before getting started with this presentation, that I will be referring to bipolar 1 as a condition throughout the presentation. And in getting started, I definitely want to highlight this graphic here and really know exactly what bipolar condition really represents. It truly represents a type of opposite type of thinking and behavior that someone might notice as a result of some of the biological and environmental factors of their development. So let's get to talk about it a little bit more and exactly what it is. So defined, bipolar condition is recognized as a pattern of mood, behavior, and thoughts that truly fluctuate between extreme highs and extreme lows. The extreme highs are recognized as manic episodes and or mania, and the lows are recognized as depressive episodes, much like that of major depression condition. So they are characterized by these dramatic shifts that really affect a person's ability to carry out daily functioning. It could be socially, occupationally, or even interpersonally. These types of highs and lows, it's important to note that they're not just a daily change. It's not like normal ups and downs that one might experience as a result of environmental factors. This is more of a specific condition in which someone is experiencing extremes in each of these areas. So I want to look at manic episodes first and really highlight what mania is in this component of bipolar condition. So as you can see by the pictures here, as well as the words, we're really looking at a persistent period of time that is at least 1 week, that's present most of the day, every day, that's really related to a mood of extremes, of elevation, expansion, or even irritability. So you can see by the pictures here, we have someone who might be really focused and elevated to get some work done and is super excited. We also have someone over here that looks a little frustrated, maybe irritable behaviors. And then we have someone down here who looks like a type of arrogance, really, which can be perceived in a manic episode. And we're going to talk about that and some of the symptoms more distinctly as we talk about the features of mania. So getting into that, we see that there's kind of some key features in manic episodes: distractibility, grandiosity. So with these things, let me focus on distractibility. When it comes to concentration, someone in a manic episode might really struggle to focus. In fact, they might be so focused, as you can see in the activities, they might be extremely goal directed, but they might not be able to maintain the focus on those activities. They might be a little sporadic. They can be seen as very intense or even really passionate. And with that, they also can have a sense of inflated ego, in which I talked about that picture of the arrogance. So someone in having a manic episode might be extremely full of themselves or overly confident in like an arrogant type of manner. And as far as their thoughts go, they might be really racing or disorganized. And that also might contribute to some thoughtlessness, such as some risky behaviors or even excessive pleasurable activity as well. In terms of sleep patterns, someone in a manic episode might have a decreased need or a decreased need for sleep, meaning that they might be very restless. It might be very hard for them to relax or get some sleep if they are in a manic episode, sometimes even staying up all night or for days at a time, depending on the seriousness of their condition. Also, in terms of speech, someone in a manic episode might have extremely pressured talking or talk more than usual or very rapid or uncircumstantial type of language in which there's a frequent or overactive communication as well. Now, on the very opposite side of that, again, with bipolar condition, we have two extreme opposites. So unlike the manic features of an episode of bipolar, the depressive features are quite different. So we still see some similarity as far as some of the themes, concentration and self-worth and thoughts and sleep, but we're going to see some key differences. So even though there might be a lack of focus in a depressive feature, there's also a diminished ability to be able to concentrate, as well as indecisiveness. So someone could be really struggling to make even the smallest decision in their life. Self-esteem greatly changes in a depressive episode. So for self-esteem, someone in a manic episode might be extremely full of themselves. Someone in a depressive episode is going to be likely really struggling with feelings of their self-worth, really low self-esteem, even guilt associated with a lot of shame and feelings of the true lack of self-worth in this episode. Activities are going to change. There's going to be more low interest in activities and low energy levels. As far as thoughts, there might be even some increased interpersonal sensitivity. So someone might get really defensive or just really hurt really easily who's experiencing a depressive episode. Sleep disturbance wise, there can be an extreme of either insomnia or hypersomnia. So in a depressive episode, one might be getting increased sleep or excessive sleep, but they still might have times in which they struggle to sleep as well. They also might experience some changes in their appetite and their weight as a sign of how they're feeling in a depressed episode. And then in regards to speech, there might be some psychomotor agitation or even like a slow occurrence of speech when one is communicating as well. So it's really that opposite side of the extreme in these two episodes. Now, as far as diagnosing bipolar condition, you really have to look at both sides of the diagnostic criteria for both mania and depression. So it's important to note that how the DSM codes bipolar 1 is through a severity spectrum of mild, moderate, or severe, and then other specifiers related to that condition as well that are unique to that individual. So, but some of the clinical things to really look out for when diagnosing bipolar condition is going to be on the manic episode side. At least 3 of those symptoms are identified. Again, noting that there is impairment related to these symptoms and that they're not related to any other medical conditions or substance use or chemical use history. Also, in order to have a diagnosis of bipolar condition, there has to be at least one lifetime episode of a manic condition, and which is noted somewhere within that client's medical history. On the depressive episode side, it's important to note that the individual needs to meet at least 5 of the major depressive symptoms that we discussed, as well as, again, the impairment that is noted, no medical conditions or chemicals that are contributing to that. And it's also important to note that for depressive condition, one doesn't necessarily need to have that as part of the bipolar diagnosis, such that they need with the manic episode. So there's some defining features, but again, it's on a spectrum that is individualized for each person. As far as what causes bipolar condition, it's important to note that research is finding extreme relation and causation when it comes to biological and genetic factors. So, for example, there's research that demonstrates that if one of a biological parent has bipolar condition, that the chances are more likely for their child. And there's also research with that in studies of siblings, particularly in identical twins, where if one identical twin is diagnosed with bipolar condition, the other twin is at 50%, also has a chance of developing the same condition. So there is research showing that there are inheritance predispositions. Also, there's research that really highlights some of the brain structure and functioning that is in genetic connections as well. So you can see in this chart here, everything is truly connected. You have the biological factors that one is predisposed to, which also could be related to their brain structure and their functioning. Research shows that there's chemicals that are different in the brain in someone that has bipolar condition. And also there's research that really shows the balance of the neurotransmitters and the messages that are getting across and how those factors on top of the chemicals in the brain could be contributing to some of these symptoms that we see in bipolar condition. Now, with that being said, as well as biological, genetic, and psychological factors, it's also important to note the environmental factors. So there is research that really shows that social and circumstantial situations can really trigger the development of bipolar condition. Some that have been found are stress-related circumstances, trauma, loss and grief, and even some medications that can really develop some of these bipolar conditions that we're seeing in either manic or depressive episodes. I do want to highlight some important facts about bipolar condition some recent research on who it affects and how many it affects. So right now, as far as 2021, research from Health Central demonstrates that 25 is the average age for someone to be diagnosed with bipolar condition. There's approximately 10 million Americans that have been currently diagnosed and living with bipolar condition. 83% of people who have been diagnosed with bipolar condition have severe symptoms. And right now, as far as gender goes, research shows there's about a 50-50 in how bipolar condition affects men and women. So we can see that there's a lot of different factors. It really can affect men and women in different ways, and it's affecting a lot of us across the US and let alone worldwide. Now, it was really interesting for me to learn some of the major comorbid diagnoses that are very hand in hand with bipolar condition. One in particular was substance abuse. So according to the AAC, substance abuse is the #1 dual diagnosis with bipolar condition. So with this, we're really looking at 3 common substances, which is alcohol, marijuana, and cocaine, as almost like a self-medication treatment that has been recognized among this population. And research really shows that because of the distressing symptoms associated with bipolar condition, that a lot of people who are not reaching out for mental health support or treatment are really taking this effort to self-medicate through different substance use. Overall, I think with this, it's important to recognize that when one is looking at the diagnoses or potential diagnoses for clients, that we're really paying attention to the chemical and substance use history as well, and really exploring their lens and how people that might have these symptoms are supporting themselves with it as well. Now, there are a variety of treatments that have been found to support those with bipolar condition. However, something that I was really able to take in as I worked on this and really learning about bipolar condition is that it truly is a holistic approach. So what they're finding in the research is that it really takes all 3 of these factors: medication, psychotherapy or counseling, and lifestyle changes to really make a full impact on one's outcomes of treatment. So for medication use, there's research on the support of mood stabilizers and antipsychotic medications, as well as even some antidepressants. And there's been found medications even in combination that seem to be working well among those 3 alone and how they can be combined to support one with treatment. However, it's important to note that Wegman really highlights in his research that no treatment for bipolar condition should be left alone without some kind of other intervention outside of medicine. So those that have been suggested have been CBT in particular, as well as family-centered therapies. With these 2 interventions, it really helps clients to explore the awareness of their thoughts and some of the things that are causing their feelings, their faulty thinking associated with some of these symptoms of their manic and depressive episodes. And it can help them to not only learn and redirect those thoughts, but also with family therapy in combination, it can help people who are supporting their family with this condition to learn about how to best support each other in the process, and also learn ways that one can help themselves and people around them as well. Also, it's important to note that lifestyle has been found to greatly impact one's treatment as well. Through education, one can gain self-awareness and really learn about maybe some of their triggers in each of those episodes, and they can take action with that knowledge to either apply more exercise or mindfulness or other strategies that they can do for themselves to really support themselves through the treatment process. I do really feel passionate about finding ways to integrate faith when it comes to any type of mental health related condition. And I really like this quote from Yarhouse and colleagues that emphasizes that those who are suffering with particularly depressive conditions may lose hope. And some of these circumstances, they can feel a really overwhelming feeling of abandonment, especially from God. So in getting this discussion started, I want to share some ways in which I've reflected on how we can support this particular population with some faith integration in the counseling process. So some things that I feel are extremely important in integrating any type of Christian faith, especially for those who are struggling with bipolar condition, would be to really help them to learn their identity in themselves as well as their relationships. So an identity for themselves, you can see here, I have some basic concepts in which with bipolar condition, it can be really easily to have a sense of shame and guilt and worthlessness and hopelessness and some of those symptoms. And so I really want to take a look here at starting with identity, how we can redirect that as counselors. So helping clients to understand their identity, understand that we are, according to scripture, we are imperfect humans, fallen creatures. We are living in a sinful world, and sometimes sin happens to us, and sometimes bad things happen as a result of our own sin. And there's a lot of factors that go into our sinful nature. However, I think it's important when we bring in these therapies to our clients to also integrate our identity in God. So we are also love. And I think it's important to help clients really redirect, again, a sense of I am a fallen human, but I'm also a being of love. I may have guilt, but I'm also able to give myself some grace and have some grace for others in my process. If a client, we know that they might be feeling some aimlessness or a lack of meaning, so we can help them to discover their purpose, again, in their identity in themselves and God. Really helping shift from helplessness to a sense of self-efficacy, from hopelessness to a sense of surrender, helping clients to see that though they may feel discouraged in the moment, that God is always in control. And together in our collaborative relationship with God, we can really work together to take action, but also trust God in the process. And then lastly, with Christian integration, I think it's really important to remember that someone who's experiencing some suffering with bipolar condition may be experiencing isolation. And so helping them to enhance their support systems or get into opportunities with other believers or other support systems that can really help remind them of who they are and how much they're loved, I think can make a huge difference in their treatment. I do want to highlight as we come to a close that there are 4 characters in particular who have really demonstrated on the screen what bipolar condition can look like. One of the newest shows that's been really getting out there in the media and bringing awareness to bipolar condition is Euphoria, in which Rue, the main character, really emphasizes the highs and lows of bipolar and really demonstrates this condition in a very artistic way. Same for Ian Gallagher from Shameless. This show has been around for over 10 years, so a lot of people have followed his journey on bipolar condition and seen the highs and lows that he has experienced. And there's 2 movies also that really demonstrate this condition. Number 3 is Silver Linings Playbook. This is a very popular movie in which it really highlights the story of someone who does have the ups and downs, but also it really kind of helps to normalize and really demonstrate what that looks like in relationships, because you see a key relationship in Pat's life in the movie in which that person also has to navigate how to support him. And lastly, in the movie Infinitely Polar Bear with Mark Ruffalo, he plays a character named Cameron, which is based on a true story about a dad who lived with bipolar condition. And it's the experience from his daughters, actually his oldest daughter, on what that was like for her. So I love to share any kind of reference to media to where if someone's really interested in looking at bipolar condition and seeing it through an artistic lens, it's always good to kind of see how it's being portrayed in movies and TV shows in the media. So here is a list of my references. I've used a variety of knowledge from our course text, which was extremely helpful in understanding this condition, as well as some really helpful health websites and websites that are dedicated to serving those who are experiencing mental health related conditions. So thank you for listening to my presentation. And if there's any questions, feel free to let me know at any time. Thank you.